Hello, good afternoon. I hope you guys are still awake at 4 p.m. So I'm Shu, also Dr. Wei. I'm currently based on Yale and just recently finished my PhD in Oxford Psychiatry, which have been focused on using virtual human to optimize VR mental health therapy. So myself, I'm a developer and a researcher, which means I got the luck to experience the frustration fighting with 3D animation pipeline in front of the computer. At the same time, got the luck to experience the frustration of testing with participants realize they don't really care about the 3D animation. They were worried about how do I twist my heads-up placement so they don't ruin my eye makeup. Don't take me wrong, eye makeup is very important. So do the facial expression and facial design of the virtual character, which is what I want to dive in today. So from digital health, we already know the connection of a virtual character and a virtual coach does matter for the therapy outcome. And virtual avatar is actually a researched subject in computer science that people already realize the more expressive character tend to have stronger social impact, which means stronger connection, stronger motivation, and sometimes stronger social impact. These two statements seem to be quite obvious. However, when looking at the intersection, it's surprising that there's actually lots of uncertainty. So 2 years ago, we actually reviewed all the existing literature in the mental health domain. What we realized is more than 80% of the VR mental health therapy actually using emotional still character. And there are multiple reasons. Virtual character creation is an expensive and resource-intensive thing by itself. Also, there's limited understanding of how different emotion is perceived by people with vulnerability. And though this set a challenge for people to enhance the VR mental health efficacy through the character, which is a very important component. And also, let's talk about money. So STARS shows for the mid to large-scale game development, they normally have ranging from 500K to even 2 million budget for developing, distribution, publishing. Sadly, looking at mental health research. So normally the startup research project funds is capped between 50 to 100K. And that's normally including the recruitment and the participant cost. Making expressive avatar needs funding, needs resource. And without funding, it's very hard to afford them, let alone test through large clinical scale. So as part of my PhD research, we try to design feasibility study to understand a very simple question. Does a VR coach's emotional attribute matters? So rather than bring people just into the lab, show them a different bunch of different virtual character as a virtual coach and ask them, which one do you prefer? We take a step back. First, we choose a mental health condition. So we choose fear of heights. Luckily, this is one of the conditions we found more than 60% of the general population have. Also, luckily, this is one of the conditions myself have, which means we have lots of free testing resource. And also, this is one of the conditions where people have relatively low social taboo associated to it, which means all the participants we get tend to be very honest when reporting their mental health condition or mental health difficulties, which fear of heights categorized at. So many of you probably working on health research, you will know the success of research is not only about your software, your analysis. Sometimes it's also about your recruitment. If you can recruit the right people, that's already close to success. And if you can recruit a large amount of right people, that's even better. So we decided two parts of the scenario where participants come into the lab, they first experience around 6-minute interactive consultation with a virtual coach to talk about their mental health condition, the fear of height issue, where the virtual coach actually follow a clinical verified script to explain the rationale and give them the feedback and coping strategy about fear of heights. After that, everyone is also given a chance to take in a walk over these virtual heights if they want. So detailedly, we try to understand two dimensions of the question. First, we want to understand, with the addition with the warm facial expression and a formative hand node with this virtual coach, does that affect people's psychological experience, which including their therapeutic alliance, which is an important factor to measure how friendly they found their VR coach is, as well as the treatment credibility and expectancy, which is another way to say how confident they are to this treatment before they even complete it. Also, as a third layer, because we do aware around virtual character research, there's an important phenomenon called uncanny valley. So sometimes if you have more effective virtual character, may not necessarily be a good thing, especially with people have high mistrust. They tend to interpret positive or ambiguous cue as negative. So we want to understand, does the mistrust tendency actually moderate their perception? At the same time, we're also looking at people's physiological experience. So during this VR, we do measure people's heart rate, skin conductance, to understand how is the physical arousal affected by different versions of the virtual coach. So looking at a scenario, here's our indoor consultation. We intentionally design our virtual coach to some scale between realistic and animated. We're also choosing a coach to be gender neutral-ish and also like racial neutral-ish, so for people who have less bias and association. In terms of the facial animation, we're actually using a facial makeup to choosing one of the actors who is actually working as a clinical psychologist, so to capture the most realistic facial expression. At the same time, we'll also review all the existing literature in terms of how to node in psychotherapy, which is another big avenue. It's not about how to node, also about when to node and how often to node. And for the outdoor experience, what you can say is actually from my home country, China. We have this place, apparently, for people with fear of height. It's the place make people's palms sweaty. I verify it's true. So based on this inspiration, we actually create a digital version, which is we also show back to a few slides back. We have these virtual heights designed to fit the real scenario, which is our testing room in a room scale. So everyone would like to give a try, we will give them the chance. And also we understand we only recruit people with severe fear of height. It can be something actually quite tricky to them. So we encourage them to first take a step and then try to walk straight and then try to walk around the circular blanket and then try to walk in back. So separate the task to different stages. So the design philosophy is we want to make it scary enough to make your palms sweat, but we also want it to not too scary to not make your heart stop. So me as a tester user, I've been trying out, and that's me. Try to play my own scenario. Ooh. Taking back. As you can see, it's in a relatively safe environment. There's no elevation, and everything actually looking between realistic and super artificial. But still, I have my hesitation when walking around. So over the course of 1 year, we've screened more than 700 people, where we successfully bring 120 people into the lab with severe fear of heights. Everyone come in knowing that they will try out an experience related to their fear of height. They will receive a consultation and having a virtual walk task. But what they don't know is we actually have 4 different versions of this software. And one of each participants will only try out one of the 4 different types of the virtual coach, either with or without warm facial expression, or with or without head nods. And it goes like that. So this is a very short clip. It may not be even that obvious from a 2D representation, but we've been play tested with more than 100 participants Also, we want it to be natural enough to almost not that noticeable unless you really know what's the cue behind the study. So what do we find out? First, in terms of the virtual therapeutic alliance, we found that both facial expression and the formative head node strongly enhance the friendliness association with the coach, and warm facial expression have the stronger impact than the affirmative head node. However, interestingly, when it comes to treatment credibility and expectancy, which is how confident they are in the treatment, although warm facial expression does make people feel the coach more friendly, but it doesn't necessarily make them feel the coach more professional. And only affirmative head node is actually making people feel they have more confidence of the VR treatment before they even complete the whole course. And when looking at the physiological responses, we measure heartbeat rate and skin conductance, which is a measure of how sweaty your skin surface are, normally as indicator of how nervous or how exciting you are. We found out the positive VR coach with the warm facial expression does elevate people's emotional arousal, which we analyze could be because they find it more friendly, not necessarily because of the scare. And all these differences only matters in the indoor consultation. When it comes to the outdoor, there are not enough difference for us to draw any conclusion. And looking at their behavior, interestingly, although it's a very fake, almost, and very safe scenario, we found that there's almost 1/3 of the participants are not able to complete this virtual walk. It takes people around 30 seconds to stop their first step, which is very powerful to see. With different quality of the virtual environment, the exposure can still trigger the real-world similar effect for people to face their fear and try to practice. So what's the main takeaway with this feasibility study? From the 120 participants who have severe fear of heights and have no idea what we're actually testing, we found out the affective feature really matters. The warm facial expression, the affirmative head node, thus changing people's perception of how friendly and how effective these social VR therapy are. At the same time, we also realize the context really matters. When thinking about the physiological and psychological impact, we realize there's no one-fit-all solution. What works in a very calm indoor consultation experience not necessarily impact the same way when it comes to the exposure scenario, which are both very important part and very common way of the VR mental health therapy. And most importantly, collaboration really matters. It goes without saying, when it comes to VR mental health therapy, it's a multidisciplinary work. It needs to require the help from the developer, the artist, as well as the people with lived experience. And this is only one of the examples. We still continue to explore how the virtual character can make the real impacts. And currently at our team in XR Pediatrics in Yale, we explore different parts with virtual human as the virtual crowds and virtual body. For example, we're using the virtual human as the virtual crowds to populate a social scenario where we simulate people vaping and generate those cues. And we test among young adults to see is there a way we can build a prediction model to predict people's future risk of initiation and addiction. Because we realize the best treatment is actually prevention. At the same time, we also explore virtual human as a virtual body. We will want participants to embody the virtual character and experience the out-of-body feeling. And this is one of the implications we plan to take the cancer wards for people to experience that and ideally to help decrease their fear of death. It's a hard work and there's a long way to go. And that's a work require and deserve a joint collaboration. And I hope this study is only a starting dialogue of the long chapter. Thank you, and time for questions.
I really appreciate the focus you had on like one specific concern around fear of heights. And I'm curious, I understand this was a feasibility study, but do you have any plans to continue to kind of build out a full module of treatment for fear of heights around this?
No, thanks, appreciate the question too. It's actually based on where I did my PhD in Oxford psychiatry. We're actually one of the team run the first ever clinical trial for fear of height, which I believe is actually a series of 4 weeks to 6 week session to treating people with fear of height, and is already approved to be clinical efficient. To answer your question, do we have a plan to test which is the best design of the virtual coach for fear of height? The answer is probably no, and that is because, as you may know, to run a whole clinical trial end to end is quite expensive, and simply just try to twist one of the design component is almost impractical. But that's exactly why those small study really matters. Because this study, we found out maybe it actually matters, and that is a good starting point for us to discuss how we can push a complete clinical trial to understand that issue. So, yeah.
Thank you. Any other questions? Yes.
Yeah, so for a little context, I think I worked for a number of years in digital therapeutics, and so primarily on basically building phone apps that would deliver cognitive behavioral therapy, primarily for treating opioid use disorder. And I think in that context, like one of the struggles that we had a lot was that, I mean, to be blunt, like it kind of sucks. Like the product is not interesting. Like it's basically a textbook, right? Because cognitive behavioral therapy is via phone app is not super engaging. And something I wonder about these sort of approaches is VR can be so much more engaging in this context. And I'm just wondering if, perhaps not, but like if there's any ability in this context to be able to test it, like what, for example, with the emotional engagement, the nodding, and these sorts of things, of whether any of those behaviors in VR also increased engagement in this context and like patient retention.
Yeah, of course. I think, for example, one of our major measure in this study is therapeutic alliance, which is highly associated with the patient engagement. And as all the technology device started to evolve, like it's more easy to integrate eye tracking, etc. Actually, for many studies we currently done in Yale, we do have eye tracking. So that is the most effective way, from my standing point of view, is to understand where people even looking at, because the visual attention is the first step to engagement and to kind of like perception. So definitely yes. Although I think there's another fold of like the information you get, especially in a therapeutic context, also have a layer of privacy concern. So that's also making this type of study taking longer than normal study, because the whole IRB approval process, but I think there's a good reason to do that, so yeah.
Thank you so much. Let's give her a hand for her presentation.